My first question for you is how often does that come up in the clinic itself? Like, how often are you telling a patient, hey, this might be a conversation for you and your partner? We should have your partner come into this conversation. So that's question one. And then the second thing is, what have you seen is the impact on intimate relationships as a consequence of dealing with cancer?
Yeah, so that's a big question. So lots of lots of different components there. So number one, talking about sex, the probably the ideal way to do this would be first to have this discussion um, privately or with the partner, whatever the patient prefers. Some people may feel more comfortable privately, other people might feel more comfortable with their partner there. So they're both, perfectly valid ways to go about it. And in fact, some people might have talked to their partner about it ahead of time, and their partner is actually their support to help them bring it up and have these concerns addressed. But if you want to talk about it privately, I think just, ask your partner to step out for a moment, or, have tell the medical team that you want to talk privately, and then they can discreetly ask them to step out. But I think it's also an important conversation to have together because unless we talk about it, the partner may not understand that all these changes are a result of medical treatment, and they may not understand what is safe, what is not safe, what are the options, what can I be doing to support my partner who's going through this. So I really think that involving the partner in these conversations is important, but it should be done in the way that the patient feels most comfortable about it. So a lot of times when I have visits about sexual health, sometimes someone will come by themselves, and other times they'll bring their partner, and it's entirely up to them.
How have you found you can help the patient explain to that partner some version of like, I love you, I care about you, but I don't want sex?
So I think that's something that a lot of people struggle with. And I think, talking about it in terms of these are the side effects of the treatment, and this is how it's impacted me. And I think one concept is that if there is any form of touch or connection, that people might be afraid if they have a low desire or they don't want to have sex, that any type of connection or touch will then lead to their partner wanting sex. And so sometimes what I see is people are even pulling away from simple touch because they don't want the next step to happen, whether that is going to be kissing or touching or sex. And they feel like once we've gone to step one, we're on an automatic, route here. And so one thing that I talk about with my patients is that with open communication with the partner, you can say, I don't feel ready for sex or comfortable for sex, but I still want to enjoy touch. So, you can kind of take certain activities off the table, but still say, I would still enjoy to do, X, Y, and Z. And one way to think about this is just everyday affection or everyday connection. And I think it's important to talk to the partner, not in the moment, but ahead of time and say, I still want to have this form of connection, but I don't feel ready or I don't want to have these other activities. And I think that can be a way to open communication, to explain where someone is um, feeling mentally and physically, and to continue that connection and support.
What about single women who are dating during treatment or after treatment?
Yeah. So I think all of the things we've talked about regarding sexual health really are applicable whether or not somebody currently has a partner or does or doesn't wish to have a partner in the future, because a lot of these things are not only about sexual health, they're about general health. Sexual health is a part of general health. And so all the stuff we've talked about, vaginal health, vulvar health, pelvic floor health, these are going to have impacts reaching far beyond sex, urinary function, even to the point of certain activities or certain clothes or doing certain things is uncomfortable, urinary tract infections, other types of pain. And so, first of all, I would say, regardless of anybody's wish to have sex or not in the future, it's important to pay attention to pelvic and genital health in general. And number two, you were asking about people dating. And so, I think even if somebody isn't dating, but they hope to be in the future, it's important to think about all of these issues because sometimes if too much time passes, things could worsen, like dryness without paying attention to that, or pelvic floor dysfunction is not just going to get better on its own. So it's important to know if there's any issues going on and to address them. And then I think it's going to be really individual when people are dating. They are going to be thinking about, do I tell a potential date that I have had a diagnosis of cancer, that I have had these treatments or maybe surgeries? And that's going to be really individual about somebody's comfort and what they want to do.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Mantacares Inc. or Mantacares' sponsors.